Alright, hello. Turning down the music a little bit. There we go. Hopefully that should be quiet enough. So the results are in. By that I mean I did my test today on stuff I taught Saturday, and I got a 92. So I might pass yet. I need to get like an 86. Technically, I think the lowest I can get is like an 85.5. Yeah. I don't know how long I'm going to be streaming today. I do have food with me, because I got home, cooked myself food, and immediately, I don't know if it was like the nerves and stuff, but I'm just not that hungry right now. But I'll have it here, just in case for later. Yeah, let me go to, give me a second. I need to get to Google Docs so I can actually open the slides. Open computer, upload. We go down to here. Okay. So, anyways, so with my recent test, I'm very happy. I decided to try to go through it. I'm not sure I'll go through every single slide, because that's like 17 slides. It's a lot. I do know there are two main ones that are going to be on the final, and then the rest will be like cumulative. So like probably about half the test will be these two, which are diabetics and acid control drugs. Excuse me. So those are going to be the ones we go through now. Let me add this, because I am talking about drugs and stuff, but again, I'm learning. I don't want people to just take my word for it because I read it off the slide and that's wrong and I messed everything up, you know? That's why it's there. Anyways. Yeah. If you see me like move off to the side, I might munch a little here and there as I go through these. Yeah. Oh crap, water. while I do my drink stuff, let me just talk a little bit more about like the test today. The test today, like because of how our school, its systems work, you don't get your like the amount, even though it's done on a computer, you don't get your grade right away. So, um, like I had like a good like 5 minutes just anxiously waiting to see my grade. There was like 6 questions. I was like, I don't know. Could be one, could be the other. And I ended up getting, originally it said 90, but my teacher went through and some of them were like fill in the blank. So like if you spelt it wrong, or like some of them were math, and like let's say you had the right number, but like it's looking for a specific thing. So if it's like looking for like, I think it was like 0.3 milliliters was like one of them, you had to do 0.3 space ml, and you had to type that exactly, otherwise it wouldn't pick it up and it would count it wrong. So my teacher went through that, and a lot of people's grades bumped up. Like as long as you had the right number, she gave it to you, unless you wrote like something like just completely unrelated in terms of like what you're trying to find. Like if you're trying to find milliliters and you write kilograms, she would, I think she said she took off of that, but there wasn't really anyone doing that. But yeah, that was fun. I was so anxious. I was really, really worried that I might not be able to like do it. And like I started actually shaking, and then once I got my grade, I was so happy that I kept shaking. I had to like walk. I had to go outside and walk to calm myself down. Like I was in tears from how happy I was. It was crazy. It really was. But yeah, so thanks to today, all I have left is just to get an 86 on my exam Wednesday. I do have a test tomorrow and another exam Thursday, but those are math. I am like the first person done. I've gotten over an 80 on basically everything. I'm passing that class. I might slow down a little bit because I don't need to rush through everything and be the first person every single time, even though I have been. Yeah. So I'll probably do that. I'm not sure exactly what I'm doing tomorrow. I know we have our final test, and then I think we have like a little bit of basically study time, like where she's just going to be reviewing. I hope it doesn't go on as long as it normally does, because she doesn't let us out until late normally. But if I'm lucky, should be able to get home and do this again. I'll probably go over a bunch of other ones tomorrow. And seeing as though tomorrow's the actual final, I might stay up until I've gone through at least a good amount of them, and I'll speed through those. Because a lot of them, it's just recognizing the drug and putting it to the type of drug it is. That is one of the things I've struggled with. Just because there's so many, they all kind of get jumbled in my head. That's why I think like me explaining it here kind of helped. because I had to explain what they were and like the types, and it made it stick better, you know? So if I can do that, I think we're good. Anyways, let's start with some diabetic drugs. That's what. Let me put another one. Text topic. That is way too big. Okay, let me change the color. Where's this one? Okay, go to topic, and then I should be able to, let's not make it this big. There we go. Can I make it bold? How do I make it bold? I don't think there's bold. Dang. Anyways. I will just make this color this though. So it's slightly easier to read. And then I'll just transform, center. There. There we go. Anyways. Hiccup. Sorry. Great. So, diabetic drugs. It's going to, first we get an overview of the pancreas, so we'll go through that. The pancreas is a large organ located behind the stomach. Functions as an exocrine gland, secreting digestive enzymes through the pancreatic duct, and an endocrine gland secreting hormones directly into the bloodstream. The two main hormones it produces are insulin and glucogen. I know how to say it. That's why. Glucose is the primary source of energy for the cells of the body. There is a normal amount of glucose that circulates in the body to meet requirements for quick energy. When quantity of glucose is sufficient, excess glucose is stored as glycogen in the liver until it is needed in the body. When the body needs it, it's converted back into glucose through glucogenolysis. I suck with words, I'm sorry. Glucogen is responsible for initiating that process. Glucagon is the protein hormone released from the alpha cells of the islets in the pancreas. In the pancreas. Insulin is secreted from the beta cells in those islets. Oh man. We're just starting and I'm already like great. A continuous hemostatic balance in the body to maintain optimal blood glucose levels is 70 to 100. Insulin has many functions in the body, such as stimulates carbohydrate metabolism by facilitating the transport of glucose into the cells. It facilitates phosphorylation from glucose to glycogen for storage, and it keeps the kidneys free of glucose. Without insulin, blood glucose levels will rise, and the kidneys are unable to reabsorb the glucose, and they excrete large amounts of glucose in the urine as ketones. When ketones are released in urine, you get loss of nutrient energy, which can cause polyphagia, which is excess hunger, polyuria, excess urination, and polydipsia, which is excess thirst. So you'll be hungry, you'll need to pee, and you'll need to drink a lot. That's what your body will be telling you. Other functions of insulin, is that it has a direct effect of fat metabolism, and it stimulates protein synthesis and promotes intracellular shift of potassium and magnesium into the cells. Pathophysiology of diabetes mellitus. Hyperglycemia, the state of having excessive concentrations of glucose in your blood. This results when the normal counterbalancing actions of glucagon and insulin fail to maintain normal glucose homeostasis. Diabetes mellitus is the disorder of carbohydrate metabolism that involves either a deficiency of insulin and resistance of tissue to insulin, or both. Uncontrolled hyperglycemia correlates with serious long-term macrovascular and microvascular complications. Those macrovascular complications are, sorry, got distracted for a second. I was just setting stuff up so I have stuff. Yes. Anyway, sorry. Those macrovascular complications are secondary to large vessel damage caused by the deposition of atherosclerotic plaque, which compromises both central and peripheral circulation. And microvascular complications are secondary to damage to the capillary vessels, which impairs peripheral circulation and damages the eyes and kidneys. In some cases, diabetes is caused by a lack of insulin that is thought to result from the destruction of beta cells in the pancreas, which causes insulin to not be able to be produced. In other cases, hyperglycemia is caused by defects in insulin receptors that result in insulin resistance. It could be they no longer respond normally to insulin molecules. Serum insulin and glucose levels are both elevated but do not respond to transport glucose in the cells, or glucose molecules remain in the blood. Most common signs of diabetes is elevated glucose levels, polyuria, polydysphagia, polyphagia, weight loss, blurred vision, and fatigue. Type 1 is characterized by a lack of insulin production or by the production of defect insulin. These patients require exogenous insulin to lower glucose. That's obviously insulin from an outside source. Genetically determined.
Rose_Warrior said, I once tried cleaning like a bidet does, but apparently it wasn't supposed to be solid.
What? Cleaning like a bidet does, but it wasn't supposed. What do you mean? What does that mean, Bear? Were you using ice? What? What do you mean? What wasn't? What was solid? I am. You've confused me. You've confused me. You made me lose track of where I was. Thank you. Thank you, Bear. I hope you're happy with yourself.
Rose_warrior said apparently they don't recommend using ice spikes.
Yeah. No, yeah. I wonder why. Where was I? This is great. Anyways.
Rose_warrior said, hey guys, did you know that Panda is a really cool dude, who apparently can't keep track of text?
I'm going through slides. I'm trying to read through slides. And when I get distracted, I lose place of where I am. Because I'm no longer looking there. I'm looking somewhere else. Anyways, type 1 diabetes.
Rose_warrior said got it, so instead of letting it slide, it slipped out.
Okay. Genetically determined autoimmune reaction gradually destroys the insulin-producing beta cells in the pancreatic islets. Thank you for that, Bats. Thank you. Okay. It gradually destroys the insulin-producing beta cells in the pancreatic islets, and results in the result is a complete lack of endogenous insulin production by the pancreas. Type 2 is the most common form of diabetes. It can be caused by both insulin resistance and insulin deficiency. There is no absolute lack of insulin like type 1. One of the normal roles of insulin is to facilitate the uptake of circulating glucose molecules into tissue to be used as energy. In type 2 diabetes mellitus,
Rose_warrior said Pancratops is a cool Yu-Gi-Oh card. I can't imagine anything being wrong with him.
Not what I'm talking about. Reduced it's the pancreas. Anyways, in type 2 diabetes mellitus, the main target tissues of insulin are resistant to the effects. Insulin levels may be normal or elevated.
Rose_warrior said, are you talking about I want to eat your pancreas?
What? I am talking about diabetes and the drugs for it, because I need to study that for my final on Wednesday. I'll probably, and along with a bunch of other stuff. And I did this on
Rose_warrior said it's an anime movie. Why would you give yourself diabetes with drugs?
No, I hate you, Bear. I hate you. And it results in impaired postprandial glucose metabolism, which just means It just means that your glucose levels are raised up when you eat food.
Rose_warrior said, thank you. Hard. Impaired granule?
reduced insulin secretions in the pancreas of the pancreas results from a loss of normal responsiveness of the beta cells in the pancreas to elevated glucose levels. When beta cells do not recognize glucose, they do not secrete insulin. There's also gestational diabetes, which is a type of hyperglycemia that develops during pregnancy. It usually subsides after the pregnancy, but it does produce an increased risk for developing type 2 diabetes.
Rose_warrior said young pancreas, am secreting diabetes.
Good lord. Controlled with diet and the use of insulin to decrease the risk of birth defects, hypoglycemia in the newborn, and high birth weight. Now for the drugs, the mechanism, the
Rose_warrior said diabetes. There
you go.
Rose_warrior said who can I have drugs?
No. They're mine. All mine. Anyways, how the drugs work for exogenous...
Rose_warrior said but drew you drugs.
I understand your disappointment. For exogenous insulin, it's a substitute for the insulin that is naturally produced by your body. It replaces insulin that is either not made or is made defectively. Functions. It restores the patient's ability to metabolize carbohydrates, fats, and proteins. It stores glucose in the liver and converts...
Rose_warrior said the drugs are kicking. With the sugar is setting in but it makes my nose hurt.
Shut up. It does not reverse the defects in insulin receptor sensitivity though. Indications of who is going to take, of why someone would be given it is obviously they have either type 1 or type 2 diabetes. Each patient requires careful customization of the dosage regimen for optimal glycemic control, because everyone's body is obviously different with it in how it's recepting and how much you're going to need to give. That is going to vary from person to person. Additional oral drug therapy and lifestyle modifications may also be indicated for type 2 diabetes mellitus. Contraindications are obviously going to be known allergies.
Rose_warrior said do your ears hang low, do they wobble to and fro, can you tie them in a knot, can you tie them in a bow?
You are just trying to just derail my stream. It's almost working. You're almost there. And another contraindication for insulin is hypoglycemic patients. If a
Rose_warrior said hooray multi-track drifting.
If a patient has hypoglycemia, you are going to want to monitor blood glucose levels prior to administration, because insulin obviously lowers blood glucose levels, so you want to try to help get them up, whether that's giving them like some type of sugary either drink or food. Next will be are the adverse effects. Obviously, it can cause hypoglycemia, and if a person has it for long enough, it can cause brain damage, shock, and possible death. Hi, Chris.
Meow.
Thank you, Chris. Obviously, hypoglycemia will be the most immediate and serious adverse effect. And again, the ones like brain damage, shock, and possible death, that is from if the patient is just kind of left with hypoglycemia. Those are just effects from having hypoglycemia. Other adverse effects could be weight gain because it's converting the glucose into fat and others, and it helps with that process. So, yeah. And the other adverse effect is lipodystrophy at the site of repeated injections. That's kind of just like, I believe, let me look it up. I believe it's kind of just your body getting irritated from being stuck in the same place. Yeah, okay. It's lipodystrophy is when you lose fat or have an abnormal distribution. And if you stick yourself with insulin enough in the same place, it can kind of move that stuff around because it has an effect on those types of cells. Interactions: corticosteroids, estrogen, diuretics, and thyroid drugs interfere with insulin, and they can increase blood glucose levels, as it'll make it not as effective is the problem. Let me do this. See if this helps more. I don't know. Oh wow. I think that actually did improve like the volume of me talking. Okay. Cool. Maybe. I don't know. Non-selective beta blockers can mask the tachycardia from hypoglycemia, which can delay symptoms of it. And hypoglycemic drugs obviously have an additive effect of decreasing hypoglycemia more. It lowers your blood levels, your blood glucose levels more. That's all that means. Rapid acting insulins, such as insulin lispro, currently 3 rapid acting. There are currently 3 rapid acting ones. You have insulin lispro, insulin aspart, and insulin glulisine. The brand names are Humalog, Novolog, and Apidra probably. Most rapid onset of action is roughly 15 minutes. The duration, that's how long it takes for it to start acting, is only 15 minutes, but it only lasts 3 to 5 hours, and its peak concentration is in those first 2 hours. It's administered subcutaneously, which just means it's basically right under the skin. Effects of insulin lispro is most like the effects of endogenous insulin produced by the pancreas in response to a meal. It's usually administered within 15 minutes of having the meal, if you are getting this type, and it is essential that patients eat a meal after the injection to raise their, to make sure their blood glucose doesn't fall too low. Short-acting insulin, such as Humulin R and Novolin R, can be given IV or subcutaneously. The IV route is usually used for like specific cases. Subcutaneous route, its onset of action is 30 to 60 minutes. Its peak concentration is about 2.5 hours in, and its duration is 6 to 10 hours. And for the IV, its onset is immediate, and its peak concentration is unknown, but its duration is 2 to 6 hours. Intermediate acting insulins, such as insulin isophane suspension, also known as NPH insulin, it's a suspension that appears cloudy or opaque. It has a slower onset of 1 to 2 hours, longer duration of about 10 to 18 hours, and a peak concentration in that 4 to 8 hour range. It's administered subcutaneously, often combined with regular insulin to reduce the number of insulin injections per day. Oh my god, there's 51 slides. Okay. Anyways, so long-acting insulins, such as insulin glargine and insulin detamers. So the brand names for those are Lantus and Levemir. They provide a constant level of insulin in the body and enhances its safety. Blood glucose levels do not rise and fall like with the other forms. It's much more stable, and if it does, it's not a steep fall. It's gradual over time. That's why it's called long acting. It's usually dosed once a day, but may be dosed every 12 hours depending on the patient's glycemic response. And it is not used they are not used interchangeably. The dosing for them is different. Insulin glargine has an onset of 1 to 2 hours, and its peak concentration, it doesn't really have a peak concentration, and its duration of action is the whole day. For non-insulin drugs, this is your biguanidines. They, such as metformin, which is currently the only drug in the class. It's not used for type 1 diabetes. It works by decreasing glucose production in the liver. It may also decrease intestinal absorption of glucose and improve insulin receptor sensitivity. It results in increased peripheral glucose use and decreased hepatic production of triglycerides and cholesterol. It does not stimulate insulin secretion, so it's not associated with weight gain. The indications are initial oral diabetes drugs, of treatment of it is for initial treatment of newly diagnosed type 2 diabetes. It may also cause moderate weight loss. It's useful for many patients with type 2 diabetes who are overweight. Also, it's also used in patients with pre-diabetes, people who don't necessarily have it yet, but maybe it looks like they're developing it. Contraindications are patients with renal or renal disease or renal dysfunction, as it's primarily excreted by the kidneys and it can accumulate, which increase the risk for development of lactic acidosis. Alcoholism or hepatic disease is also another thing, as those affect your kidneys. Metabolic acidosis. Again, it can increase those lactic acids, and other conditions that predispose, and other. It's also contraindicated in other conditions that predispose to tissue hypoxia and increase the risk of lactic acidosis. Its adverse effects are nausea, cramping, feeling of fullness, and diarrhea, especially at the start of therapy, meaning when you first start taking it. Although some less common ones are metallic taste, hypoglycemia. God, I'm getting crazy. Hypoglycemia and the reduction in B12 levels for long-term use. Its interactions, use of metformin with iodine-containing radiologic contrast has been associated with acute renal failure. Metformin therapy should be held the day of the test and for at least 48 hours after the patient undergoes the radiologic study to make sure all of those iodine containing contrast is out of the body. Diuretics have additive effects and they can cause more hypoglycemia, as your body could wash out even more stuff that way. Metformin it works by inhibiting hepatic glucose. Isn't that what I just talked about? Yeah. Sulfonylurase. Its mechanism of action and drug effects are well, first these are glyphosate, also known as glucotrol, glyburide, which is diabeta, and glympyride, which is the brand name Amaro. They bind to specific receptors on beta cells in the pancreas to stimulate the release of insulin. Secondarily, they decrease the secretion of glucogen. For this class to be effective, the patient must still have functioning beta cells in the pancreas. This works more for when they have resistance. In patients who have that resistance to insulin, rather than just them not being there anymore. That's why they work best in the early stages of type 2 diabetes, and it's not really used in type 1. Sulfonylurea, anyways, the indications of them are that they can be used in conjunction with metformin and thiazolidines, dinones. God, I hate these words. They're not used in patients with advanced diabetes dependent on insulin administration, because in those cases, beta cells are no longer able to produce insulin, and once insulin is started, this type of medicine should be stopped. Its contraindications are if the patient has hypoglycemia or conditions that can predispose someone to it. Or the potential for cross allergy in patients who are allergic to sulfonamide antibiotics. Some adverse effects are obviously hypoglycemia, because it brings down those glucose levels. That's what the drug is made to do. It can lead to weight gain. Other adverse effects are skin rash, nausea, epigastric fullness, and heartburn. Some interactions it has are with beta blockers, erythropoietin, fluconazole, sulfa antibiotics, garlic, ginger, and ginseng. Sorry, I swear I know that word. It can cause its effects to enhance and increase the amount it drops your blood glucose by. Carbamazepine, phenobarbital, and rifampin can increase metabolism, which decreases its effectiveness. Glipizide, also known as glucotrol, it has a very rapid onset but a short duration of action. When patients with type 2 diabetes take the med, it rapidly stimulates the pancreas to release insulin and facilitates the transport of excess glucose from the blood into the cells of muscles, the liver, and adipose tissue, which is, I believe, fat. It works best if given 30 minutes before meals, allowing the timing of insulin secretion induced by the drug to correspond with the elevation in blood glucose levels induced by the meal. Next, we have glynides. Glinides. I can't read, man. This is repaglinide, also known as Prandin, and nateglinide, also known as Starlix. And they are the only two drugs in the class. Structurally different from sulfonylureas, but they have a similar mechanism of action. They also increase insulin secretion from the pancreas, but they have a much shorter duration of action and must be given with each meal. Its indications are people with diabetes, like all the other drugs. It's almost like we're talking about diabetes drugs. They may be particularly useful for diabetics with high postprandial glucose levels, who have low levels of circulating insulin, and can be used with metformin and thiazolidines, but not combined with sulfonylureas. They are contraindicated for those who are taking sulfonylureas, as they have the same action. So you don't want to give them, it's just saying you don't want to give them together again. Its adverse effects, obviously hypoglycemia, if you're not keeping up with the levels. It can occur particularly if food is not eaten after a dose, and weight gain is also common. Repaglinide, Prandin, its mechanism of action. It's helpful in treatment of patients who have erratic eating behaviors, and they stimulate the release of insulin from pancreatic beta cells. thiazolinidine dineons. God, it's like reading Doug Dimmadone's name. Thiazolina Doug Dimmadone Dines. Like, fucking, who came up with this name? They are most commonly referred to as glidizones. They act by regulating genes involving in glucose and lipid metabolism. They are insulin sensitizing drugs. They work to decrease insulin resistance by enhancing the sensitivity of insulin receptors and are known to directly stimulate peripheral glucose uptake and storage. The effect gene regulation has a slow onset action, which could take several weeks. Pioglitazone, Actos, is the only readily available drug in its class. Its indications are people with type 2 diabetes. They may be combined with metformin or the other one, and they can also be used with insulin. They are contraindicated for patients who have moderate to severe heart failure and are used with caution in patients with liver or kidney disease. The black box warning is that it can cause an exorbitant and can cause or exacerbate heart failure and are not recommended for use in patients with symptomatic heart failure. They also commonly cause peripheral edema and weight gain. Weight gain may be due to both water retention and an increase in adipose tissue. Also associated with reduced bone mineral density and increased risk for fractures. Actos, also known as pioglitazone, is used alone or with other drugs. They work by decreasing insulin resistance and can worsen or precipitate heart failure. Alpha glucosidase inhibitors. They're less commonly used oral drugs. The main two are acarbose, or with the brand name Precose, or Miglitol with the brand name of Glycet. They work by reversibly inhibiting the enzyme alpha glucosidase that is found in the small intestine. This enzyme is responsible for the hydrolysis of oligosaccharides and disaccharides to glucose. When the enzyme is blocked, glucose absorption is delayed. The timing of administration is important and must be taken with food. Postprandial blood glucose elevation can be prevented or reduced. This means you don't take in as much glucose. It's indicated in people with type 2 diabetes, usually in combination with oral hypoglycemic drugs, and may be particularly effective in controlling high postprandial glucose levels. It's contraindicated due to GI adverse effects such as inflammatory bowel disease, malabsorption syndromes, or intestinal obstructions. Its adverse effects is that it can cause high incidence of flatulence, diarrhea, and abdominal pain. In high dosages, it can elevate the levels of hepatic enzymes, and they do not cause hypoglycemia or weight gain, as it just prevents the sudden intake of glucose. Uh, the interactions are digoxin and propranolol. Uh, those drugs can make bioavailability of these drugs. Oh, the bioavailability of these drugs are reduced when taken with an alpha glucosidase inhibitor, meaning it kind of just lessens the amount that's in your body. Acarbose, yeah, contraindicated patients cite hypersensitivity, DKA, cirrhosis, inflammatory bowel disease, colonic ulceration, partial intestinal obstruction, or chronic intestinal disease. Dipeptidyl peptidase 4 inhibitor, also known as sitagliptin, with the brand name of Januvia. It selectively inhibits action of dipeptidyl peptidase 4, which increases the concentration of naturally occurring incretins GLP-1 in gastric inhibitory peptide, reduce fasting and postprandial glucose concentrations. You monitor patients closely for pancreatitis after initiation or dose increase, and may increase hate words. Digoxin levels when given concurrently. Its only contraindication is known allergies and indication. Adjust to diet and exercise to improve glycemic control in adults with type 2 diabetes. Glucagon-like peptide 1 agonist. This is liraglutide with the brand name Victoza. Its three main functions are that it enhances glucose-dependent insulin secretions, suppresses elevated glucogen secretion, and it slows gastric emptying. It's administered subcutaneously and once daily. Its black box warning for risk for developing thyroid C-cell tumors. Adverse effects are nausea, vomiting, and diarrhea. And in rare cases of hemorrhagic or necrotizing pancreatitis has been reported. Hemorrhagic or necrotizing pancreatitis. So it can cause pancreatitis. Glucose elevating drugs. Hyperglycemia is abnormally low. This would be when it's below 70. Early signs are confusion, irritability, tremor, and sweating. Later symptoms are hypothermia, seizures, coma, and death. Oral forms of concentrated glucose are available for patients who are alert. When a patient is not alert, meaning they're unconscious, IV glucose is used. Conceptions up to 50% dextrose in water. Glucogen may be given intramuscular. May also be given intramuscular if no IV site is established. Roll, and then if you do that, you want to roll the unconscious patient to their side as it may induce vomiting. That is the last one of that. Okay. Give me 1 second. I'm just typing to someone while I pull up the next PowerPoint. That did only take me an hour, which is nice. Okay. Let me get to the next one. We're looking at 28. Honestly, I think that only took me like maybe half an hour to get there, actually. Probably more like 45 minutes. Let me eat something. Okay. So, the next thing we'll be doing, the next thing I'll be talking about is acid controlling drugs. This is going to be like antacids. So acid-related pathophysiology, your stomach secretes several substances with various functions, such as hydrochloric acid, which aids digestion and serves as a barrier to infection. Bicarbonate, a base that naturally prevents hyperacidity. Pepsinogen, which is an enzymatic precursor to pepsin, which is the enzyme that digests dietary proteins. The intrinsic factor is a glycoprotein that facilitates gastric absorption of vitamin B12. You have mucus that protects the stomach lining from both the hydrochloric acid and digestive enzymes. You have prostaglandins, which have a variety of anti-inflammatory and protective functions. The stomach is divided into 3 functional areas: the cardiac zone, the fundic and gastric zone, and the pyloric zone. Gastric glands are highly specialized secretory glands composed of several different types of cells: parietal, chief, mucus, endocrine, and enterochromaffin. Each cell secretes a specific substance. Parietal cells produce and secrete hydrochloric acid. It's the primary site of action for many drugs that are used to treat acid-related disorders. Chief cells secrete pepsinogen. Mucus cells obviously secrete mucus. When the balance of these cells and their secretions are impaired, acid-related diseases can occur. The most harmful are peptic ulcer disease and esophageal cancer, although the most common ones are gastroesophageal reflux disease, or GERD. GERD has a tendency of excessive and acidic stomach acid content. What? GERD is a tendency of excessive and acidic stomach acid contents to back up or reflux into the lower esophagus. Over time, GERD can lead to more serious disorders such as erosive esophagus and Barrett's esophagus. Hydrochloric acid is secreted by the parietal cells in the lining of the stomach and maintains the environment of the stomach at a pH of 1 to 4. Acidity aids in the proper digestion of foods and defends the body against microbial infection by the GI tract. Food, caffeine, chocolate, and alcohol stimulate hydrochloric acid secretion, and the wall of the parietal cells contain these types of receptors: acetylcholine, choline, histamine, and gastrin. When any of these are occupied by a chemical stimulant, hydrochloric acid will be secreted. When a histamine receptor is occupied, production of adenylate cyclase, it causes the production of adenylate cyclase, which converts adenosine triphosphate, also known as ATP, to cyclic adenosine monophosphate, which provides energy for the proton pump, which transports hydrogen atoms. It's a pump for the transport of hydrogen atoms and is located in the parietal cells. When the proton pump is activated, pump is able to transport hydrogen ions needed for the production of hydrochloric acid. And peptic ulcer disease is the term for gastric duodenal ulcers that involve digestion of the GI mucosa by enzyme pepsin. The process of ulceration is driven by the protein breakdown actions of pepsin with the effects of hydrochloric acid. Now, onto the actual drugs. We have antacids, which are basic compounds used to neutralize stomach acid. They're the most common non-prescription salts. Most common are non-prescription salts of aluminum, magnesium, calcium, or sodium. And many antacids prescriptions also contain the anti-flatulent Antigus drug. Okay, Antigus is the brand name, but it's an anti-flatulent drug called simethicone. They work primarily by neutralizing gastric acidity. Do not prevent the overproduction of acid, just help neutralize the secretions. They also promote gastric mucosal defensive mechanisms. This happens by stimulating the secretions of mucus, prostaglandins, and bicarbonate from the cells inside the gastric glands. The primary drug effect is a reduction of symptoms associated with various acid-related disorders, such as pain and reflux. Indications for it are acute relief of symptoms associated with peptic ulcer, gastritis, hyperacidity, or heartburn. They are contraindicated in anyone who has an allergy to them, or people who have severe renal failure or electrolyte disturbances. This is due to the potential toxic accumulation of electrolytes in the antacids themselves. And it's also contraindicated in those who have a GI obstruction. Adverse effects are magnesium preparations can cause diarrhea, aluminum and calcium containing can result in constipation. Calcium products can also cause kidney stones and rebound hyperacidity. Excessive use of any antacid can result in systemic alkalosis, which just means that your stomach is a lot lower than what it should be, as it's used to being very acidic. It can become more basic, and that can cause problems. And it's more common of a problem with sodium bicarbonate. Long-term self-medication with antacids may mask symptoms of serious underlying disease, such as bleeding ulcer or malignancy. Malignancy. I can word. I swear, dude. I swear I can read. I swear I'm smart sometimes. Don't look into it. So the interactions it has, most drugs are either weak acids or bases, and pH conditions in both the GI and urinary tracts will affect the extent to which the drug molecules are absorbed. Benzodiazepines, sulfonurase, and sympathomimetics have pH effects and can increase the effects of interacting drugs. Allopurinol, tetracyclines, thyroid hormones, corticosteroids, salicylates, and quinolone antibiotics decrease GI. It can cause decreased GI absorption of them, reducing the effects of those drugs. And antacids are either given 1 to 2 hours before or they should be given, if they are given with them, 1 to 2 hours before or 1 to 2 hours afterwards. That way your stomach has time to go back to normal, and it'll be able to absorb those medicines properly. Antacids in general are numerous individual antacid products on the market containing either magnesium, aluminum, calcium, or sodium, such as Tums, Malix, Mylata, Alka-Seltzer, milk magnesium. They allow patients a variety of options for self-medication. They are normally considered safe for use during pregnancy. Aluminum and sodium-based antacids are recommended for patients who are renal compromised, as they are easily excreted than the others, and calcium and magnesium are more likely, and also calcium and magnesium are more likely to accumulate to toxic levels in the kidneys. Calcium carbonate neutralization will produce gas and possibly belching. Magnesium-containing antacids commonly have a laxative effect. H2 receptor agonists reduce but do not completely abolish acid secretion. They competitively block the H2 receptor of acid-producing parietal cells, and it makes the parietal cells less responsive to stimulation of histamine, ACH, and gastrin. Drug effects are that it reduced hydrogen ion secretion from the parietal cells, which results in an increase in the pH of the stomach, which can cause relief of symptoms associated with hyperacidity-related conditions. So this is something you're given if your stomach is too acidic. And yeah, which obviously means it could start digesting itself. That's the problem. H2 receptor antagonist indications. It's used for the treatment of GERD, peptic ulcer disease, and erosive esophagus. Adjunct therapy in the control of the upper GI tract bleeding. And note, these are all reasons why to take it, not the other way around. Adjunct therapy and control of GI tract upper GI tract bleeding, treatment of pathologic gastric hypersecretory conditions, and are commonly used for stress ulcers, prophylaxis in critically ill patients. That means it's used before they can get them. If anyone forgot what prophylactic means. H2, now the contraindications are allergies and liver or kidney dysfunction may warrant dosage adjustment. Because it messes with your intestines, and your liver and kidney interact with those a lot, obviously. So if those aren't working, it can be a reason to adjust the drug, obviously. Adverse effects are low incidence. There's low incidence of adverse effects, although they can be cardiovascular, which can lead to hypotension if it's administered from an IV. For the central nervous system, you can have headaches, lethargy, depression, hallucinations, and agitation. For the GI tract, it can cause diarrhea, nausea, or abdominal cramps. For the gastrourinary tract, it can cause impotence and increase BUN and creatinine levels. Integumentary, it can cause rash, flushing, and alopecia, and it can also cause thrombocytopenia. Its interactions, cimetidine carries a higher risk for drug interactions than the other drugs in its class. Theophylline, warfarin, lidocaine, and phenytoin can raise the concentrations of interacting drugs, which can increase their effects. Smoking has been shown to decrease the effectiveness of H2 antagonists, and for optimal results, H2RA are taken 1-2 hours before antacids, if they're being taken with them. Cimetidine, known as the brand name Tagamet, became the first drug in its class to be released on the market due to potential to cause drug interactions. Famotidine is more common and may be used to treat certain allergic reactions. Famotidine, known by the brand name Pepcid, has very few drug interactions and adverse effects. It's available as an oral form or injectable form, and it's used for the treatment of GERD and for allergic reactions. Proton pump inhibitors. The action of hydrogen potassium ATPase pump is the final step in the acid secretory process of the parietal cells. PPIs bind directly to this pump mechanism and irreversibly inhibit the action of the enzymes, results in a total blockage of hydrogen ion secretion from the parietal cells and blocks all gastric secretions. It's indicated as a first-line therapy for erosive esophagus, symptomatic GERD, short-term treatment of active duodenal ulcers and active benign gastric ulcers, and in gastric hypersecretory conditions. And its only contraindication is drug allergies. Its adverse effects are, although it is generally well tolerated, drugs may be overprescribed and could predispose patients to GI tract infections. New concerns about long-term use causing osteoporosis, and concern about a possible link between PPIs and dementia. Those are just concerns, they're not confirmed yet. That's why they're not in adverse effects. Few drug interactions occur with PPIs. They may increase serum levels of diazepam and phenytoin. I hate words. They may increase the chance of bleeding when taken with warfarin. Food may decrease absorption of PPIs and should be taken on an empty stomach. Omeprazole, also known as Prilosec, is orally administered. It works best within 30 to 60 minutes before meals. Its onset action is 2 hours, and its peak concentration takes up to 5 days. Pantoprazole, also known as Frontenac, is the first PPI available for IV use. It's the first drug to be used as a continuous infusion for the treatment of GI bleeding, and is also available as an oral tablet. Um, I forgot to do this. Pretend I did. Pantoprazole, also known as Protonix, as it says, the first PPI available for IV. It's the first drug to be used as a continuous infusion for the treatment of GI bleeding, and is also available as an oral tablet and delayed release granules for NG administration. Miscellaneous acid controlling drugs such as sucralfate, known by the brand name Serafate, used as a mucosal protectant in the treatment of active stress ulceration and in long-term therapy for peptic ulcer disease. It acts locally, not systematically, by binding directly to the surface of an ulcer. When the drug comes into contact with acid of the stomach, it begins to dissolve into aluminum hydroxide, which is an antacid, and add sulfate anions. Which stimulate the secretion of both mucus and bicarbonate base. Dosing may be up to 4 times a day. This is for lower compliance, though. Adverse effects are uncommon, but they include nausea, constipation, and dry mouth. It can interfere with absorption of other drugs, so it should be given 2 hours before or after them. And its best effects if given 1 hour before meals and at bedtime. Misoprostol, also known as Cytotec, is shown to effectively reduce the incidence of gastric ulcers in patients taking NSAIDs. They inhibit gastric acid secretion and protect the gastric mucosa from injury. Adverse effects are headache, GI distress, and vaginal bleeding. It's contraindicated in pregnancy, as sometimes it can be, as it's sometimes used for absorptions up to 12 weeks. Sometimes used for abortions up to 12 weeks. Although it has no major drug interactions. And the last one is simethicone, also known as Mylicon. It's used to reduce the discomfort of gastric or intestinal gas. It's classified as an anti-gas drug. It works by altering the elasticity of mucus-coated gas bubbles and causes them to break into smaller ones. It reduces gastric pain and facilitates the expulsion of they spoke gas wrong on this. It says has. The expulsion of gas by either the mouth or rectum. No listed adverse effects it has no listed adverse effects or drug interactions. It's available only for oral use, and its usual dosing is 1 to 2 tablets, 4 to 6 times daily as needed. Alright, we're doing good. I'll probably come back to those tomorrow, as they are, my teacher said they will be important for our final exam, as they weren't on a test yet, so they'll make up a good amount of our questions. But they're not going to be the only things. So, all right. I'm just gonna look at one thing. I just want to look at and make sure that I'm reading the right slides. Come on. Trying to see if I can find something, but apparently I don't have it downloaded on my phone. You know, I swear I could have. Like, I could have sworn I had it downloaded, but apparently not. Great. I scream. Why is it trying to open it in this? Okay. All right. No. Here we go. This took me way too long. Okay. I don't feel like I don't know. Okay. Um. I'm just trying to find what I think I should try to study next. don't think I need this one. I'm just going through all of them. Why did it not open? There we go. Okay. Although I don't really feel like these... I feel like I don't really need to do these ones as much. The ones from the first week. Just kind of looking over them. I might just kind of review, like, just go over these ones on my own. So the overview for... so, yeah. Overview: drug is just any chemical that affects the physiologic process of a living organism, and pharmacology is the study of it. Drug classifications are done by structure or therapeutic use. And a prototypical drug is the first drug in a class of drugs. Yeah. I don't think I really need to do this one. This is my problem, is I'm not sure which ones I really need to study. Hi, Madeline. No. What? There. I have drank. No more. Please. I beg. Okay. This one's probably better to go over. Because I think I mostly just need to go over the various types of drugs. Not the stuff from the first week. Why? Why do you do this? There. Ugh. Okay. Time to drink water. I see that. Thank you. Huh. So Okay, so I guess now that I've gone through the two I wanted to go through, I'll probably come back to tomorrow. I will go over the I'll go over adrenergic drugs, and then after that I'll go over cholinergic. So, adrenergic drugs, they affect your nervous system. They stimulate more specifically, they stimulate the sympathetic nervous system, and they are known as adrenergic. They are also known as adrenergic agonists or sympathomimetics, as they mimic the effect of the sympathetic nervous system neurotransmitters, and are also classified as catecholamines. And these are those things are stuff like dopamine, epinephrine, and norepinephrine. That one. That's how you say it. I swear. And any adrenergic will dilate pupils. It'll inhibit the flow of saliva. It'll accelerate. It'll raise your heartbeat and your blood pressure. It'll dilate your bronchi, which are your lungs, and it'll inhibit your gastral intestines and what's the word? Your GI tract and your gastrourinary tract. And in these, you have alpha 1 receptors. For the receptors, you have alpha 1, alpha 2, and beta 1, 2, and 3. Alpha 1 is located on the postsynaptic effector cells. Alpha 2 are located on the presynaptic nerve terminals. Beta 1 is in the heart, beta 2 is in the lungs, and beta 3 is on the bladder. We remember this. Alpha 1. Why can't I remember it right now? You know what's annoying is that I wrote it down so many times and I can't remember it. Hold on. It's gotta be in here. Hold on. Not here. No, that's math. Man. It annoys me because I should know these. Oh yeah, it's here. Alpha 1 affects your blood vessels, alpha 2 is nerves. Yeah, that's what it is. Alpha 1's blood vessels. Let me remember that. The indications for them are adrenergics are used for treatment of a variety of illnesses and conditions, selectively for alpha and beta receptors, and an affinity for certain tissue and organs determine the usage. These could be respiratory illnesses, nasal decongestions, ophthalmic indications, overactive bladder treatment, and cardiovascular disease. Respiratory indications are adrenergic, stimulate beta 2 receptors, and can cause bronchodilation. They are helpful for treating asthma and bronchitis. Indications for topical nasal decongestants are transnasal applications. Adrenergics can cause dilated arterioles and reduction in nasal blood flow, decreasing decongestion, and they work by stimulating alpha-1 receptors. Ophthalmic indications, drugs that are applied to the surface of the eye and work by stimulating alpha receptors located in the small arterioles of the eye to cause arterial vasoconstriction, to reduce conjunctival constriction. They're helpful for treating open-angle glaucoma, dilation for diagnostic studies, and effects produced by stimulating alpha or beta 2 receptors or both. Overactive bladder indications, beta 3 would be your beta 3s. Cardiovascular indications can act on various alpha or beta receptors, and they are known as vasoactive sympathomimetics or vasopressors, and they are helpful for treating cardiac failure or shock. They're contraindicated for obviously allergies and hypertension, as remember they will raise your heart rate and your blood pressure. Adverse effects can be unwanted CNS effects, such as headache, restlessness, excitement, insomnia, euphoria. They can have cardiovascular effects such as chest pain, vasoconstriction, hypertension, bradycardia, or dysrhythmias. They can have effects on other systems such as anorexia, dry mouth, nausea, vomiting, and sometimes taste changes. CNS effects of beta adrenergics can be mild tremors, headaches, dizziness, or nervousness. Cardiovascular effects increase heart rate, increase blood pressure, palpitations, and other effects are sweating, nausea, vomiting, and muscle cramps. Toxicity and management of overdose. Toxic effects are an extension of their adverse effects. The two most life-threatening effects include CNS and cardiovascular. They are seizures they can cause seizures, intracranial bleeding due to increased blood pressure, and elevated blood pressure increases risk for hemorrhage throughout the body. The treatment is just to lower blood pressure by using rapidly acting sympatholytic drug and supportive care of respiratory and cardiac systems. Adrenergics have short half-lives, so effects are short-lived. When toxicity occurs, stop taking the drug. Stopping the drug causes toxic symptoms to subside in a relatively short time as it gets out of the body really quickly. Interactions. Many interactions can result in diminished effect due to direct antagonism at receptor sites. Some can be life-threatening. When adrenergic drugs are given with an adrenergic antagonist, they antagonize each other, causing reduced therapeutic effects. Administration of adrenergic and anesthetic drugs increase the risk for cardiac dysrhythmias. Administration with MAOIs cause life-threatening hypertensive crisis. Antihistamines and thyroid preparations increase the effects of adrenergic drugs. Drug profiles. Vasoactive adrenergics have primarily cardioselective effects and are used to support failing heart or treat shock. They're used to treat orthostatic hypotension. They are very potent, quick-acting injectable drugs. All these drugs are titrated to desired physiologic response. All are rapid in onset and effects will cease quickly when infusion stops. They require careful titration and monitoring of vital signs. Dobutamine is only available as a continuous IV. They stimulate beta 1. Which, as you know, can help stimulates beta 1 receptors in the heart, increasing cardiac output by increasing contractility, and can increase stroke volume, especially in patients with heart failure. Beta 1 selective vasoactive adrenergic drug is structurally similar to naturally occurring dopamine. Dopamine is naturally occurring, but yeah, a lot of the means, I believe, are a type of adrenergic. So dobutamine, it stimulates beta 1. Dopamine, yeah, we did dobutamine. Dopamine is naturally occurring neurotransmitter, potent dopamine, beta 1 and alpha 1 adrenergic receptor activity in low doses can dilate blood vessels in brain, kidney, heart, and mesentery to increase blood flow. Highest doses cause vasoconstriction, alpha 1 receptor activity. They are contraindicated with in patients with pheochromocytoma, a catecholamin secreting tumor, and it's available as an IV injectable drug or given by an IV. Epinephrine is an endogenous vasoactive cathephylamine. Oh my god, I can't say these words. They acts directly on both alpha and beta receptors of tissue innervated by the sympathetic nervous system. It's administered in emergency situations. One of the primary vasoactive drugs used in many advanced cardiac life support protocols. Low doses stimulate beta 1 receptors, increasing force of contraction and heart rate. It's used to treat acute asthma and anaphylactic shock due to bronchodilator effects. High dosages stimulate alpha 1 receptors, causing vasoconstriction to elevate blood pressure, and are available in two strengths for IV. One I believe that's supposed to be 1 milligram per milliliter and 0.1 milligram per milliliter. It just says 1M, and I don't think it means meter. Phenyldopamin is a peripheral dopamine agonist indicated for lowering blood pressure. It produces blood pressure lowering effects by inducing arteriolar vasodilation through stimulation of dopamine receptors. It's short-term treatment of hypertension, of severe hypertension, and may have beneficial effects on renal function, increasing renal blood flow, given by an IV. Midodrine is converted in the liver to active form. This midodrine, it's an apple. Oh, there's a lot. So for assessment, you have alpha adrenergic receptors cause vasoconstriction, beta 1 adrenergic receptors cause cardiac stimulation, and beta 2 adrenergic receptors cause bronchodilation. Beta 3 obviously are cause you to pee. Use of adrenergic agonists requires careful patient assessment and monitoring to maximize therapeutic effects and minimize possible adverse effects. Nursing implementation, tuberculin syringe. Yeah. I'm very tired. It's 11. I worked 8 hours. I went to class, had a test, had other stuff. I'm very tired. I kind of just want to get here as I've gotten to the end of it. Okay. Let me open one more, and then I'll end it after I go through it. I'm just trying to breeze through these because, yeah. I'm going to do cholinergic, which is which works on the parasympathetic nervous system. It does rest and digest. It has the opposite effects of adrenergic drugs. So it's going to constrict your pupils. It's going to lower your blood pressure and heart rate. It's going to constrict your bronchi. It's going to cause you to go to the bathroom more. It's going to cause more saliva. Yeah. The neurotransmitter responsible for the transmission of nerve impulses to the effector cells of the PNS is acetylcholine, and cholinergic receptors bind acetylcholine and mediates its actions. There's two types of cholinergic receptors: nicotinic receptors, which are located in the ganglia of both the PNS and the SNS, and muscarinic receptors, located postsympathetically in the effector organ supplied by the parasympathetic fibers. Cholinergic drugs are known as cholinergic agonists or parasympathomimetics. They stimulate cholinergic receptors, either directly or indirectly. Directly would be by bonding, and indirectly with them, and indirectly would be stimulating post-sympathetic release of acetylcholine at the receptor site, allowing it to bind to the receptor. Acetylcholinesterase is the enzyme responsible for breaking down acetylcholine. Can be referred to as cholinesterase. There's two categories of cholinesterase inhibitors: reversible, which binds to cholinesterase for a short period of time, and irreversible, which bind for a longer duration. And the body must generate new cholinesterase enzymes to override the effects of the irreversible one. Mechanism of action and drug effects. When acetylcholine binds to receptors, it causes stimulation. When binding takes place on the membrane of an effector cell, the permeability of the cell changes and allows calcium and sodium to flow into the cell. Cholinergic drugs are primarily used for their effects on the GI tract, bladder, eye, and eye. Intestines and bladder are stimulated. When stimulated, cause increased gastric secretions, GI motility, and urinary frequency. Stimulation and constipation of pupils decrease. Intraocular pressure. They can cause increased salivation, sweating, reduced heart rate, vasodilation, and constricts the bronchi. Recommended dosages affect the muscarinic receptors. High doses stimulate nicotine receptors, causing an undesirable effect. Indications are typically to reduce intraocular pressure in patients with glaucoma. Most are given topically due to poor oral absorption, with exception of a few. They may be used to treat atony of the bladder and GI tract, which causes increased bladder and GI tract tone and motility. They may treat dry mouth by causing more saliva to be produced. Um, Drugs that cause skeletal muscle contractions uh, could be are for the treatment of uh, myasthenia gravis. The ability to inhibit acetylcholinase is useful for the reversal of neuromuscular blockage produced by neuromuscular blocking drugs or by anticholinergic poisoning. It is also for the treatment of Alzheimer's disease, as patients have decreased levels of acetylcholine. Although it does not reverse it, it can slow it down. Contraindications are allergies, GI or GU tract obstruction, bradycardia, defects in the cardiac impulse conduction, hyperthyroidism, epilepsy, hypotension, COPD, and Parkinson's disease. Parkinson's disease is listed as a precaution because cholinergic drugs are used in patients with Parkinson's disease and dementia. So they can have additive effects. Primary adverse effects are consequences of overstimulation of the parasympathetic nervous system, bradycardia or tachycardia, hypotension or hypertension, depending on which receptors are stimulated, syncope, conduction abnormalities, headaches, dizziness, convulsions, all the fun stuff. Cholinergic crisis is when severe muscle weakness and respiratory paralysis due to excessive acetylcholine is there. Early signs is abdominal cramping, salivation, flushing of the skin, nausea, and vomiting. Symptoms are circulatory collapse, hypotension, bloody diarrhea, shock, and cardiac arrest. Remember this stuff by using the term sludge, which stands for salivation, lacrimation, urinary incontinence, diarrhea, GI cramps, and emesis. It has interactions. Drugs that may antagonize cholinergic drugs, such as anticholinergics, antihistamines, and sympathomimetics. Drugs, and it has additive effects with other cholinergic drugs. Direct acting cholinergic agonists, treatment of acute post-op and postpartum non-obtrusive urinary retention associated with neurogenic atony of the bladder, can increases bladder tone and motility. This is for bethanical. Avoided in patients whom the integrity of the GI tract or bladder wall is questionable. Donepezil is a cholinesterase inhibitor that works centrally in the brain to increase the levels as acetylcholine by inhibiting acetylcholinesterase. Adverse effects are normally mild to and resolve on the own. It has some interactions with NSAIDs which can cause GI bleeding. Memetine is not a cholinergic drug, but it's treatment for Alzheimer's. As I said, it doesn't reverse it, but it does slow it down by blocking the receptors. Pyridostigmine is an indirect cholinergic drug. It's shown to improve muscle strength. It's used to relieve symptoms of myasthenia gravis, most commonly used for symptomatic treatment of myasthenia gravis. May also be used in treatment of severe overdose of tricyclic antidepressants due to the anticholinergic effects associated with tricyclics. Its adverse effects include GI upset and excessive salivation. Prior to the administration of these, you want a full head-to-toe assessment, including close assessment of neurologic status. You want to test their short and long-term memory, level of alertness, motor, cognitive, and sensory function, and any SI or thoughts. Also pay close attention to urinary patterns for signs of retention. And for implementation, you want to maximize therapeutic effects. If drugs are given to increase peristalsis, ambulate the patient. You need to ambulate the patient and push fiber and fluids. Drugs used in treatment of Alzheimer's are not given for curative purposes. And you should explain this to the patient's friends and family. Monitor dizziness and hypotension. Implement fall precaution. So you need to implement fall precautions. Educate not. Hi, J-Mom. Educate not to discontinue abruptly. Potential, as it has potential for rapid decline in cognitive functioning and patient condition. Any monitor sludge to identify cholinergic crisis. When do we tell him he's muted? Do you think he notices? Now I'm just going to quickly go over anticholinergics and anti-andronergics. Yes, I did. Okay. Then I think that might be a good stopping point after these two, because I still need to get some sleep. And tomorrow,
Damn, I'm late. Shit, fuck.
yeah. I mean, I've been streaming for like 2 hours. I'll probably
Yeah, but you
do
just said
more
that you're
tomorrow.
gonna stop.
I'm probably gonna do more tomorrow.
Damn. Have to wait until tomorrow? I can't believe this.
Crazy.
I'm gonna die.
Okay. So, for andronergic blocking drugs or anti-andronergics, they have the opposite effects of andronergic drugs. So they do have similar effects to parasympathetic drugs. They block response of receptors. They also are referred to sympatholytic because they inhibit the sympathetic nervous system. And andronergic blocks act at various receptor sites and is classified by the receptor they block, such as alpha blockers, beta blockers, or alpha beta blockers.
Alpha beta? What?
I know, crazy.
You telling me they cock block?
Alpha blockers, mechanisms of action. They block alpha 1 receptors of the sympathetic nervous system. Alpha blockers work by direct competition with norepinephrine or by a non-competitive process. They have a greater affinity for the alpha adrenergic receptor than norepinephrine does, so they can chemically displace norepinephrine molecules from the receptor. The blockage at the receptor site causes vasodilation, reduces blood pressure, causes meiosis, which is pupillary constriction, and reduce smooth muscle tone in organs. Which just means that it causes you to not pee and poop as much. Alpha blocker indications. So they're used as they cause arterial and venous dilation, which reduces peripheral vascular resistance and blood pressure. They're used to treat hypertension. As they reduce smooth muscle contraction of the bladder, in a urinary tract. They are used to help treat benign prostatic hyperplasia. In terms
Prosthetic?
of prostatic,
Prosthetic?
no, no.
But prosthetic? See, this is how you remember shit. Why? Because you
Bruh.
remember my dumbass saying it wrong.
This is like when Bear joined in at the start of my stream and just said diabetes over and over again.
He did that?
I was going over diabetes drugs. So he just spammed the TTS with diabetes.
Diabetes. Diabetes.
For frostbite,
Diabetes.
for frostbite, Raynaud's disease, and acrocyanosis. They cause...
Cyanide?
No. They cause increased endogenous alpha adrenergic agonist activity, resulting in vasoconstriction, meaning it gets the blood away from those areas so they don't cause as much damage. Phenazamine inhibits responses to adrenergic stimulation and reverse the effects of injected epinephrine or no epinephrine. Phentolamine is used to reverse vasoconstriction and restores blood flow to ischemic tissue. The contraindications for alpha blockers are allergies, peripheral vascular disease, hepatic or renal disease, coronary artery disease, peptic ulcers, and sepsis. For adverse effects, they are related to the effects of vasculature. The first dose of them can be reduced due to it being the first time administered. Although, so you might need. So, wait, no. I'm reading this wrong. Hate everything. The first dose phenomenon of of alpha blockers could be a severe and sudden drop in blood pressure after administration of the first dose of an alpha blocker, which may cause the patient to fall or pass out. It can also cause orthostatic hypotension with any dose of an alpha blocker. So you want to educate the patient to get up slowly, and if they are going to stand up, you want them to have them sit up for a little bit before they do. As due to having lower blood pressure, they are more prone to having dizziness, headache, and mostly dizziness and loss of balance. And this is especially true if they're going from one position to another. Other adverse effects are headache and constipation.
And death, of course. It's always death.
Alpha blocker toxicity and management of overdose. Overdoses of oral or injectable forms of treatment include symptomatic and supportive measures as needed. Hypotension may be treated with fluids and vasopressors. Anticonvulsants may be administered for control of seizures.
Scissors?
Yes, scissors.
Controlled scissors?
Alpha blocker interactions. God damn it. Alpha blocker interactions. The most severe are drugs that increase the effects of alpha blockers. Alpha blockers, which, so stuff like parasympathetic, cholinergic drugs, as they do the same thing as anti-adrenergics. They should not really be taken together. Alpha blockers are highly protein bound and compete for binding sites. Interactions with other highly protein bound drugs allow more free alpha blocker molecules to circulate in the bloodstream, such as warfarin, ED meds, or other antihypertensives. Phentylamine is one of these that's used to treat hypertension. It is only available as an injectable, and it's most commonly used to treat extravasation of vasoconstricting drugs. It's administered subcutaneously around the site, increasing blood flow to the ischemic issue. Tamsulosin is primarily used to treat BPH in male patients. It may also be used for kidney stones or urinary retention. Blocks alpha adrenergic receptors on smooth muscle, with the prostate and bladder, relaxing smooth muscle and improving urinary flow. It's contraindicated for people who are allergic to it and with concurrent use of ED meds. Beta blockers' mechanisms of action are they block the sympathetic nervous system stimulation of beta adrenergic receptors, and they can be selective or non-selective, meaning they block all of the types of beta receptors or just one of the specifically one of the three. Beta 1 receptors, primarily in the heart, reduce heart rate and slows conduction through the AV node, which decreased oxygen demand by decreasing contractility. Beta blockers selective for these receptors are beta 1 blocker drugs, beta 2 blockers. Beta blockers that block both beta 1 and 2 are non-selective, obviously because they block both. Beta 2 blockers. Beta 2 receptors are primarily in the smooth muscle of the bronchioles and blood vessels, causing bronchial smooth muscle contraction and narrowing of the airways. They are also categorized on if they have intrinsic sympathomimetic activity. Paradoxical action of some beta blocking drugs is that they mimic the action of the sympathetic nervous system. Non-selective beta blockers block glycogenolysis and delay recovery from hypoglycemia and mask the symptoms. They may also block secretion of insulin and elevate glucose levels. However, they can cause either hyper or hypoglycemia. Some indications are angina, as they decrease the demand for cardiac energy and oxygen consumption and help shift supply-demand ratio to supply more oxygen to the heart, which helps relieve pain caused by lack of oxygen. It can help with myocardial infections, which inhibits stimulation of myocardium by circulating catecholamines, which are released during which are released. Can prevent catecholamines from binding by beta blocker binding to beta 1 receptors, and protect the heart from being stimulated by catecholamines. Dysrhythmias can occur. If a patient has a dysrhythmia, it can help get it to beat normal, the heart beat normally again, as it slows conduction through the AV and SA nodes. And it can also help with hypertension and heart failure. Beta blocker contraindications are allergies, uncompensated heart failure, cardiogenic shock, heart block, bradycardia, pregnancy, severe pulmonary disease, and Raynaud's disease. And its black box warning is that it should not be stopped abruptly, and it should be tapered over 1 to 2 weeks. That way your body can get back to working normally without the drug. Most adverse effects are mild and diminish over time. The most common are bradycardia, depression, impotence, constipation, and fatigue. The most serious caused by acute withdrawal from the most serious ones are caused by acute withdrawal of medication, which stopping suddenly may exacerbate underlying angina, precipitate and MI, or cause rebound hypertension. Delay recovery from it can delay recovery from hypoglycemia in patients with type 1 diabetes. Oh man. Okay.
You're a tired boy, aren't you?
A little bit. It's almost like I worked and then went to school and then I did this.
Fair enough.
I've been streaming for 2.5 hours. It's great.
2 hours, that's nothing. That's nah.
Shut up.
If you need rest, you really should go get rest.
I will after I'm done with this. Beta blockers toxicity and management of overdose. Treatment of symptomatic and supportive care. Atropine to beat bradycardia. Severe hypotension. You use fluids and vasopressors. If ineffective, you may need a pacemaker inserted. Hemodialysis may be useful in elimination of drug in severe overdoses, and beta blockers are easily dialysable. Oh man. For their interactions, antacids can decrease absorption. Anticholinergics can be antagonistic, which because they may be fighting over the same receptors. Diuretics or cardiovascular drugs can have an additive effect, increasing hypotensive effects. and oral hypoglycemic drugs and insulin can mask signs of hypoglycemia, delaying recovery for hypoglycemia. Atenolol
Antenna
prevents
lol? What?
atenolol.
Antenna lol?
That is just the end of like any beta blocker. Is OLOL.
But let's change back in antenna lol.
Bruh. Prevents future
I
heart
know, I'm
attacks in
thinking.
patients who have previously had one. Treats hypertension, angina. Shut up. And management of
I say nothing. You're the one who said it.
thyrotoxicosis to help block symptoms of excessive thyroid activity. Carvedilol helps treat. It's primarily used in the treatment of heart failure, although it can also be used in hypertension and angina. I keep saying it now. I hate everything.
No. That's how you remember.
It's shown
it.
to slow
Keep saying
progression
it.
of heart failure and decreased hospitalization in patients with moderate heart failure. When used to treat heart failure, it is usually added to dioxin, furosemide, and ACE inhibitors. Esmolol is a very strong, short-acting beta-1 blocker. Is primarily used in acute situations of SVT and to provide rapid temporary control of the ventricular rate.
Asbestos?
Which word did you hear as asbestos?
What word do you think?
I don't know.
Don't worry about it. It doesn't matter.
Yeah, it has a very short half-life and it is only given as an IV infusion. Labetalol, it can block both alpha and beta adrenergic receptors, and it's used to treat severe hypertension and it's used in hypertensive emergencies to quickly lower blood pressure. Metoprolol is the most commonly used beta-1 blocker. Studies have shown increased survival in patients who have experienced an MI. When given IV, it is considered a high alert drug and patients should be monitored. Propranolol is a non-selective beta-1 and beta-2 blocker. It is one of the first beta blockers. It's contraindicated in patients with bronchial asthma. And it helps treat tachydysrhythmias, thyrotoxicosis, migraine headaches, and essential tremors. Sotalol is a non-selective beta blocker with very potent anti-dysrhythmic properties. It's commonly used for management of difficult to treat dysrhythmias. These rhythms are often life-threatening ventricular dysrhythmias such as VTAC. Due to being a non-selective beta blocker, it can cause some unwanted adverse effects such as hypotension. I have one left. It is the shortest one I've done today.
What you're saying is that you're done.
Almost. One chapter left. So, I'll now be doing cholinergic blocking drugs, which have par- uh, blah, 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 blah.
Bit?
They affect the parasympathetic nervous system. They branch. Branch of the autonomic nervous system with nerve functions opposite of those in the sympathetic nervous system. Acetylcholine is the neurotransmitter responsible for transmission of nerve impulses. Cholinergic receptors bind to acetylcholine and mediates its actions, and cholinergic blocking drugs inhibit that. They are also called anticholinergics or parasympatholytics. They block the actions of acetylcholine in the parasympathetic nervous system and are one of the oldest groups of therapeutic drugs. The mechanism of action of these drugs, they're used to block the action of the neurotransmitter acetylcholine at the muscarinic receptors in the parasympathetic nervous system. As the drug obviously blocks it from the name's anticholinergic blocking, it'll cause it to fail to bind, and so the cholinergic effect will not be produced. Blocking of the parasympathetic nerves allows the sympathetic or adrenergic nervous system to take over. Anticholinergics may have similar effects as adrenergics. Cholinergic blockers are a competitive agonist as they compete with acetylcholine for binding at muscarinic receptors in the parasympathetic nervous system. Once bound, they inhibit nerve transmission. It occurs at the neuroeffector junction, which is the point where the nerve ending reaches the effector organs. Cholinergic blockers have little effect at nicotinic receptors unless we have high doses, and then at high doses they have a partial blocking effect. Major sites of action are the height, respiratory tract, GI tract, urinary bladder, eyes, and exocrine glands. They have the opposite effects of cholinergic drugs, so they increase heart rate, increase your blood pressure, they dry mucous membrane, and decreases GI motility and secretions, along with urinary secretions. It dilates your pupils and increases in intraocular pressure. It's indicated for patients with Parkinson's disease as the drugs-induced reaction of drug-induced. I can't speak. It's also used for drug-induced reactions of antipsychotic drugs, dysfunction of the extrapyramidal parts of the brain, and include motor dysfunctions such as chorea, dystonia, and dyskinesia. They can also decrease muscle rigidity and diminish tremors. At low doses, they may slow the heart. At high doses, they block the inhibitory vagal effects of the pacemaker cells, which can lead to increased heart rate. In the respiratory system, it decreases secretions in the nose, mouth, pharynx, and bronchi. They also cause relaxation of smooth muscle in the bronchi and bronchioles, decreasing the airway resistance and bronchodilation, and is used in treatment of bronchitis, asthma, and COPD. Treatment of irritable bowel diseases and GI hypersecretory states. It's contraindicated in allergies, ankylosing glaucoma, cardiovascular instability, and with people who have a GI or GU tract obstruction. Adverse effects are increased heart rate, dysrhythmia, restlessness, irritability, hallucinations, delirium, drowsiness, sedation, confusion, dilated pupils. It can cause blurry vision, urinary retention, decreased sweating, and decreased bronchial secretions. Treatment of overdose consists of symptomatic and supportive therapy. If you are hospitalized with continuous, if you are hospitalized for it, you'll have continuous EKG monitoring. Activated charcoal can cause removal of it from the GI tract that has not been absorbed yet. Although this must happen within 1 hour of ingesting the drugs. The cholinergic drug physostigmine to treat delirium, hallucinations, coma, and cardiac dysrhythmias. It can also be used as an antidote for atropine specifically. Interactions, additive anticholinergic effects when taken with drugs that produce anticholinergic side effects, such as antihistamines, and tricyclic antidepressants. It also increases effects of
You got this.
Digosion. I can't say it. I just can't say it. With when given with
You just did.
anticholinergic. So atropine is a naturally occurring anti-muscarinic. It's used to treat bradycardia and ventricular asystole. It's used as an antidote for anticholinerase inhibitor toxicity and poisoning. It's used pre-operatively to reduce salivation and GI secretions. Dicyclomine is used primarily in treatment of irritable bowel syndrome, and it's contraindicated in patients with paralytic ileus, GI atony, or toxic megacolon.
Megacolon?
Yeah, it might be megacolon, but it's spelled megacolon.
So you're calling it megacolon. That's fair. That's fair. It's megacolon now. I don't know what you're talking about.
Glycopyrrolate is an anti-muscarinic drug. It blocks receptor sites in the autonomic nervous system that controls the production of secretions. It's used preoperatively to reduce salivation and excessive secretions in respiratory and GI tracts. Oxybutynin is an anti-muscarinic drug that's used for the treatment of overactive bladder. It's also used as an antispasmodic for neurogenic bladder associated with spinal cord injuries and spina bifida. It's contraindicated.
Yo, these words got made the fuck up. What the hell are you saying? You casting a spell?
Yeah. That's why everyone's scared of medicine. We're actually just casting spells.
Stop casting magic on me. You're gonna blow me up. No, don't blow me. Don't blow me up. Stop trying to summon fireball.
Fireball!
No! You're welcome.
Okay. So, scopolamine is a naturally occurring cholinergic blocker, most potent, and it's the most potent anti-muscarinic for prevention of motion sickness. It works by correcting imbalance between acetylcholine and norepinephrine in higher centers in the brain, particularly the vomiting center. It's a transdermal patch for motion sickness, change every 3 days. And you also want to avoid over-the-counter medications when you're using it. It can cause drowsiness, dry mouth, and blurred vision. And using it with CNS depressants or alcohol may increase sedation.
But alcohol, my alcohol.
And last is tolterodine, which is a muscarinic receptor blocker for the treatment of urinary frequency, urgency, and urge inconsistence. That's it. I'm done for today.
Nah, can't be.
Has to be.
You must keep going.
No.
Yes, you must.
I don't think I will. Have a good night.
Oh, okay.
Have to go.
No, don't go.
Sleep. It's almost midnight.
No, I'll sleep for the week. Who needs sleep?
Bye-bye. Me.
No.
Goodbye. Bye-bye. Good night.
Okay, goodbye bye.
Okay. So, is anyone streaming? Not really. Wait, no, I just didn't scroll down because I'm dumb. I'll bring this here. Thank you, Jaymon. I'm just going to raid my friend Sakura. It's been a bit since I raided her. Anyways, I'll probably be back tomorrow with more studying. And hopefully I'll be able to get through everything. I really do hope I can. I really do hope I do well on this final exam, because I need it. Anyways, have a good night.